Let's remind you that we all have an important role to play in stopping the spread of COVID-19. We encourage you to take the necessary precautions to protect yourselves and families by always wearing a face mask, practicing social distancing, and washing or sanitizing your hands frequently. Welcome to Info Hub for Wednesday, September 2. Thank you for joining us as we highlight the work of the PPPC administration aimed at improving the quality of life of all Guyanese. President of the Cooperative Republic of Guyana, His Excellency Dr. Mohamed Irfan Ali, is assuring indigenous Guyanese that the PPPC government remains resolute in ensuring their well-being.
During a virtual address on Tuesday evening to mark the launch of Amerindian Heritage Month, His Excellency Dr. Mohamed Irfan Ali announced that soon the government will be introducing measures aimed directly at providing relief to individual households amid the COVID-19 pandemic.
I've directed the Minister of Health to fast-track hinterland interventions and measures, and he has advised me that following sweeping consultations currently underway with Amerindian leaders, emergency measures will be announced shortly. Sadly, over the past 5 years, there was an unfortunate regression in your development, which we shall immediately reverse. Not only will we reverse the backward steps imposed by the coalition government, but we will unlock a new era of rapid transformation for the hinterland communities and our forest peoples. And we will not wait for the COVID-19 pandemic to subside. My government will soon initiate a virtual consultation with the National Two-House Council to chart the course for the delivery of our manifesto promises.
Indigenous communities can look forward to the reintroduction of the Household Solar and the Community Development Programs, the revision of the Amerindian Act, as well as the implementation of livelihood improvement initiatives. Meanwhile, Minister of Amerindian Affairs, Honorable Pauline Sukai, promised that the government will address existing challenges in Amerindian villages.
Amerindians will see the resumption of development intervention and programs, which will advance food security, economic activities, youth development, and the preservation of culture and languages, among other key and critical areas for attention, such as land titling and governance issues.
She added that scholarships for tertiary education and the installation of ICT infrastructure are also on the agenda. This year's Amerindian Heritage Month is being celebrated under the theme Fostering Traditional Practices for a Safe Environment. Neola Dimon, Info Hub.
In another show of the PPPC government's commitment to the well-being of Guyanese, His Excellency Dr. Mohamed Irfan Ali on Tuesday distributed over 800 hampers to families and vulnerable groups in several communities in East Berbice Quarantine Region 6 to bring relief to those experiencing challenges due to the COVID-19 pandemic.
President of the Cooperative Republic of Guyana, His Excellency Dr. Mohamed Irfan Ali, reiterated his government's commitment to delivering on its manifesto promises.
I have made a commitment that I'm going to work every single day, that the government is going to work every single day in the best interest of all the people of our country. And that is the commitment we are going to give you and continue to work and strive towards, giving you the best possible service we can in government.
During his recent visit to Region 6, His Excellency conveyed that the People's Progressive Party civic government has raised $5 billion to provide relief for households and families impacted by the novel coronavirus. He also informed the residents of his administration's targeted plan to bring back jobs in the communities.
We also knew that there were limited intervention in terms of bringing relief to the community, bringing relief at the household level, bringing relief at the family level. We are going to ensure we make the necessary investment to bring back the jobs that were lost in these communities.
The head of state assured residents that under the People's Progressive Party administration, through the Education Ministry, is currently exploring measures to ensure children continue to learn amid the pandemic.
We have to ensure that they continue to learn. We have to ensure that they have access to the curriculum. We have to ensure they have access to the teaching material. And the Minister of Education has been working on this over the last 2 weeks. And very soon, before the end of this week, we'll be announcing measures that will ensure children have access to learning material and learning opportunity whilst we manage through this period of the COVID pandemic.
For InfoHub, Gavin Lewis.
Meanwhile, Attorney General and Minister of Legal Affairs, the Honorable Anil Nandlal, says the APNU-AFC coalition demonstrated its incompetence when its members walked out during the sitting of the National Assembly on Tuesday.
We welcome robust scrutiny. We welcome a formidable challenge. We welcome a competent opposition. That is not present in this bunch.
Attorney General and Minister of Legal Affairs, Honorable Anil Nandlal. He expressed his view on the National Communications Network's program Insight in relation to the APNU-AFC's walking out of the first sitting of the National Assembly of the 12th Parliament on Tuesday. In addition to the swearing-in of members of Parliament, over $11.2 billion was approved unopposed by the National Assembly as current and capital spending for the 16 constitutional agencies for 2020. The scrutiny of the agency's budgetary allocations was without the input of the opposition, who had moments before walked out of the proceedings. AG Nandlal said the APNU-AFC showed its incompetence to represent Guyanese.
This dishonest bunch, unfortunately, will not be able to represent an opposition's interest, in my view, against our government. They could have come there and asked for more and demonstrate why these constitutional agencies should get more. Instead, they took their oath of office, fill up their forms to see that they're MPs, to ensure that they get their salary at the end of the month, and they walked out.
The minister said the walkout by the opposition is an indication of the pattern of what is to come over the next 5 years. For InfoHub, Anarakan.
In response to a statement released by the APNU-AFC coalition on former Director of Sports and Member of Parliament Christopher Jones' COVID-19 test results being publicly disclosed, Minister of Health, the Honorable Dr. Frank Anthony, has made it clear that it is his responsibility to ensure the safety of all Guyanese.
As the Minister of Health, I think when I see that the public is put in danger in such a way, then I have a right to inform the relevant authority, and in this case, the persons who are managing the parliament. So that is why the clerk was informed yesterday.
That was the Minister of Health, Honorable Dr. Frank Anthony. Dr. Anthony also highlighted that no one is above the law, and all health protocols must be adhered to in order to collectively curtail the spread of the novel coronavirus.
We have an order in place, and we also have a public health law. That law clearly states that if anybody knowingly spread an infectious disease, then they're committing an offense. The Parliament and the clerk of the Parliament 2 days ago put out a letter to all members of Parliament to clearly state that if you have COVID-19, that you shouldn't attend the Parliament in person, but you can do so virtually.
For InfoHub, Gavin Lewis.
More news is after this short break. Stay with us.
I am DJ Garwin with more testing being done. Previous undetected COVID-19 cases are now being detected. Guyanese, COVID is no joke. Take it serious. Remember, keep your family safe, protect yourself, respect yourself. Wear a mask and wear it correctly. Remember, every time you go out, social distances, wash your hands, sanitize your hands, and stay safe, Guyanese. COVID-19 is very serious, so I urge you all to stay safe and remember the guidelines of COVID-19.
Welcome back. With a daily increase of COVID-19 cases, Health Minister, the Honorable Dr. Frank Anthony, during a COVID-19 update, disclosed safety measures that are in place to limit the spread of the virus.
Health Minister, Honorable Dr. Frank Anthony, informed that while there are different measures in place for each administrative region, reverting to the nationwide 6 p.m. to 6 a.m. curfew will assist in limiting the spread of the novel coronavirus. The curfew was announced by an order published in the official gazette and is scheduled to last until the end of September.
What we have done, based on the epidemiological situation across the country, we are able to disaggregate that by region. We know how many cases we have in a given region, how many are active, what's the rate of transmission in these regions. And based on this set of information, then we make decisions of how to tackle the epidemic in the particular region. So we try to tailor-made or customize the measures to suit specific regions, and that is what was done in this particular order.
Public servants and employees in semi-autonomous agencies will continue to work under a rotational system to prevent a crowded working environment and essentially contributing to limiting the spread of COVID-19.
What we are looking at is to ensure that wherever you're working, you have adequate social distancing measures. Every workplace should actually come up with their own set of plans, utilizing the broad principles that we have established. Those principles are, one, that you're able to sanitize your hands regularly. Two, to have social distancing, so at least that's 6 feet apart. And so you don't want people to be, very close to each other and so forth.
Dr. Anthony relayed that in keeping with safety measures, both the Eugene F. Correa and Chedijagan International airports will remain closed to commercial traffic, with exceptions of cargo flights that bring in COVID-19 relief supplies.
There are countries around us, other countries in the world where the incidence of COVID-19 are much higher. And the chances that persons traveling from those countries coming into Guyana, they can actually come with the disease. So one way of limiting spread, or one way of limiting the importation of the disease, is to restrict movements through our airport.
For InfoHub, Gavin Lewis.
Still in the health sector, the Indian High Commissioner and the Pan American Health Organization, World Health Organization, today handed over medical supplies to the Ministry of Health.
Minister of Health, Honorable Dr. Frank Anthony, collected the medical equipment, hydroxychloroquine tablets, and PPEs on behalf of his ministry. Minister Anthony thanked the High Commission, the Government of India, and PAHO WHO for the assistance. Minister Anthony said that during a visit to the West Demerara Regional Hospital, he observed that it is a hospital that needs rebuilding in many ways.
We are extremely grateful that we have now, in some ways, re-energized the projects that deals with the 3 regional hospitals, West Demerara Hospital, Sadi Hospital, and the Bartika Hospital. We are really happy that we can move forward this project because it is not, it is something that would help us to provide quality care in these regions.
The High Commissioner of India, His Excellency Dr. K.J. Srinivasa, expressed that his country is looking forward to the collaboration with the government of Guyana to upgrade the 3 regional hospitals.
Today, as Dr. Madhe was mentioning, is a momentous occasion. Today we are formally handing over the components which were procured under the Indian government's $1 million aid under the COVID prevention which Government of India sanctioned. We are also looking at active collaboration with the Government of Guyana as part of our $17.5 million line of credit to upgrade the 3 hospitals, regional hospitals in West Demerara, in Sadi and Bartika.
Present at the handing over ceremony were CEO of the Georgetown Public Hospital, Brigadier Retired George A. Lewis, and Dr. Vishwa Mahadio, Director General for Regional Health Service. For InfoHub, Anara Khan.
Minister of Human Services and Social Security, the Honorable Dr. Vindhya Prasad, has pledged her commitment and support to the Children and Family Center, which serves as a temporary sanctuary for at-risk children and families.
On Wednesday afternoon, Minister of Human Services and Social Security, Honorable Dr. Vindhya Prasad, visited the Plum Park Sophia Children and Family Center, where she was met with the bright, smiling faces of the children who are housed there. During the tour of the facility, the minister interacted with the children and staff. In an invited comment, she expressed that the visit was a heartwarming one.
For me, when children are affected by abuse, and in many cases sexual abuse, it is heartbreaking to even imagine that a child has to deal with that on a daily basis. Adults have great difficulty dealing with that. So to go there today and to see the children in a different frame of mind coming out of situations and circumstances like that, it warmed my heart.
She complimented the director of the Child Care and Protection Agency, Anne Green, along with the staff of the facility for working with the children during the COVID-19 pandemic to ensure they had the opportunity to express themselves in creative ways.
Art, music, and dance in particular, because those are things that tend to bring out emotions from children. And so for me, it was something that I believe every child should experience, especially when they come from such tragic circumstances. So this kind of forum that children have through that agency is something I want to encourage whenever children have to come into our care.
Dr. Prasad also indicated that she was impressed that the center not only caters for children, but also those family members who are similarly affected. The $250 million Children and Family Care Center, which was the first of its kind, was commissioned in September 2019. The center can house up to 80 individuals at one time and is accessible 24/7. For InfoHub, Anara Khan.
Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including Facebook, YouTube, and Instagram, and visit our website, dpi.gov.gy, as we bring you the latest and important news on what the government is doing to ensure the continued development of our country. Your bridge reports are up next. Goodbye for now.